So for those of you who don't know me, I am Kristen Wick. I am the marketing and foundation manager. So I am the person who sends out the weekly communications. So if you want to connect a face with the email, it is me. I'm going to go ahead and share my screen. Can everyone see that okay? Good. I know we have one person on the phone, so you probably can't see what I'm sharing.
I can imagine.
So today we're going to keep the same agenda that we had before. We're going to start with kind of our introductions, who's on the call, and we're going to do some housekeeping rules, going to do some resident moments, a little bit of the COVID-19 review. Um, oh, I got two people in the waiting room. Going to add them in. Um, we're going to talk about visitation. I'm sure some of you are wondering what's going on with that. Our COVID-19 testing, and then we'll talk about questions. So if you have any questions, um, on the call today is probably just going to be Stacy because I haven't seen Gail up on there yet. But when it comes to questions, please remember to keep them non-resident specific. If you have resident specific questions, you can certainly email Amanda or contact Amanda. Her information will be at the very end of the slide. And then also, we do have a chat box available, so you can feel free to ask questions in the chat box. We'll answer them best we can. Um, Stacy has a lot more knowledge than I do, as she is the license administrator for the Care Center. So I am going to just start with some resident moments. So again, it shouldn't take more than 30 minutes. We really do like to keep it kind of tight. As always, if you have questions, we're more than happy to go longer. And again, the chat box. And then we do share the recording. Now, because before we were just doing care center and now we're doing all long-term care, so that's assisted living and care center, we're going to move this information on the Zoom families to the long-term care COVID page. And you should have gotten that information on the email on Friday. So that's if you go to our website and you click on assisted living or care center, you're going to see a tab for long-term care COVID update. And if you click on that, you're going to get the weekly updates. That's where we're going to house them, but we're also going to house the Zoom calls there as well, moving forward. So you can look for that there. I try to get them up by the end of the day Wednesday. So as you can imagine, it's been difficult. In the care center, we still are doing compassionate care visits and hospice visits, end of life, but we're trying to keep everyone busy. And some of the things I know we add, people had questions. What was it, Tuesdays with Tammy last time? And this is kind of a sample of Tuesdays with Tammy. You can see that they're watching an exercise video and they're doing some of the poses. And so what they do there is, let's see. So what they do there is just follow along with the video and have fun, and they laugh because a lot of the videos are kind of outdated, but they have fun moving and sharing. What you see in this picture right here is that's kind of the country store. It goes around after bingo and people are able to purchase some items. I know I have an uncle in there who loves Fiddle Faddle. So I always see him when I'm walking down the hall with Fiddle Faddle in his hand. So we always try to bring him some Fiddle Faddle We tried to bring it in at least once a week to him. And then Terry Nelson, he performed in the chapel. And the nice thing about the video feeds in the care center is they're able to watch that in their rooms. And so he can perform music right there, and they can live stream it right into their rooms. And the care center activity staff and the rest of the staff does a great job of going around and making sure everyone who wants to watch the performance happening in the chapel has switched to that TV. And then over here, you see a couple of ladies playing bingo. And, you know, bingo is still one of their top priorities and fun activities. And so we're doing it a little bit differently. They have their own chips. They keep them in their own room. And we play bingo by, again, using that screen right here in the chapel. And they announce it. They're watching it on their TV. But then we also have staff in the hallway, and they're helping people. And when there's a bingo, they radio it in. So it's always fun because then they announce it over the TV as well. Stacy, are you on?
Yep, I'm here.
Okay. I just went over the resident moments.
Great, thank you. So thanks for everybody for joining in today. It's been another crazy day in the world of Johnson Memorial and trying to deal with the various things that are going on. So it's actually fun to take a moment and see some of these pictures and remember some of the stories that are going on in the events despite all the chaos. So it's fun to see that. So we'll probably go right on to the next slide. Oh, and again, for those of you who haven't met me, I'm Stacy Lee. I'm the CEO and the nursing home administrator at Johnson Memorial. So we're going to go over some COVID numbers. So as you can tell, for Lac qui Parle right now, we have had 87 confirmed, but 33 active. And what that means is we've really had some more community spread in recent weeks. I'm sure all of you probably are watching some of the different postings that are done by the regulatory agencies, but you know, we have had 87 cases since the beginning of March, but the majority of these cases are in this last 2 to 4 week period. So it puts us on heightened security just to make sure we're really watching things. And you know, the last thing we want is to have exposures to our staff and the residents and the tenants, while still making sure that everyone is having some joyful moments and living and not feeling like they're confined. So it's a tricky balance. But you can see also in Chippewa, which is Montevideo right down the road, they have a lot more confirmed cases, but not quite percentage-wise as much active. So Lac qui Parle really has kind of had this own little mini hotspot here. Swift County, which is Canby, and no, Swift County is, oh, help me out, Kristen. Benson and Appleton, sorry, Benson and Appleton. So, you know, again, you can see their percentage of confirms is much lower. They have a lot more confirmed, but a lot less active. So they've had more earlier on. Yellow Medicine has quite a few also. That is Canby and Granite Falls. And then of course, Wilmer and Marshall are listed there as well. And one other thing, Kristen, can you go back one slide? Just to note now that we have had 2 deaths in Lac qui Parle. So we continue to monitor those because 1 death is tragic, and we're just trying to do what we can to keep those numbers low. Our Minnesota, we kind of look at our MDH, Minnesota Department of Health, also as another source of statistics. So the positivity rate is something that is used quite often for different measures. It's used to decide how much you need to test in long-term cares, which in our care centers in Minnesota. It also is used to determine visitation, how much visitation you can have. So right now you can see we're at 4.1% and Minnesota is at 5.3. So we're doing a little bit better than Minnesota, but we've been doing some more testing lately with in Lac-Qui-Parle County with having to test all the staff and the residents and tenants. That has increased our denominator. So that, you know, if you, this is calculated by the positive test divided by the total test given. So if the total test given increase more than the positive tests, our number is going to come down there. So we're just watching that as we go. The case rate is another factor we look at, and we use this mainly to look at it for the school closings, or not closings, but how they're dealing with their hybrid models. But we also use it here for our visitation as well. So we look at some of those numbers. So right now, our case rate, we have 76 in Lac-Qui-Parle County, 47 are without isolation. So you can see that there are some more numbers. Now, they might be a little bit different because of timing wise. So you can see, so we have a higher percentage that are still in quarantine than the Minnesota overall does. Our cumulative case rate, 112. Not sure about the Minnesota number there. We might have to double check that stat.
Yeah, when I look at that, I think that's wrong.
Yeah. Again, we've had 2 deaths in Lac-Qui-Parle County. And then of the 76 cases that we have had in our county, 47 of them are in Dawson zip code. So we've had quite a bit in Dawson lately, and we're just, fortunately, not a lot of hospitalizations. So that's a really good thing. So there might be cases where we've had to send some out for hospitalization or for higher level of care. But most of our cases are able to quarantine at home and recover at home if they have symptoms, and if they don't have symptoms, just to quarantine. So a lot of numbers, I know. And again, as I'm sure Kristen mentioned, you don't need to write all these down because they'll be posted out on our website if you care to go back and look at them. We'll fix that one number before we post it. Okay, so and then this is just a slide that's recapping our COVID cases in the long-term care. So as you know, we've been doing weekly testing now for, I think, 4 weeks. So of those 4 weeks, we've had 0 residents test positive, which is just awesome. It's so great. We have had only 1 care center staff test positive, and they've since recovered. I don't believe there was symptoms. There was just a quarantine for this care center staff. Assisted living. Oh no, we have one currently on isolation or in quarantine. But we've also had a previous staff that has been recovered. For assisted living, we had 1 tenant test positive. No assisted living staff are currently positive, and we have 1 that tested positive a while back, but is recovered since. So I hope this slide is helpful for you guys. This is kind of what we're going to keep updating and let you know. So the current cases are what currently is happening in the past week, and the recovered cases are ones that have been identified previously but are recovered. Okay. So this one is regarding visitation. This is just such a hot topic for so many important reasons. You know, we all know how much you love the residents and the tenants, your family members, and how tragic it is when you can't see them face to face. I mean, Zoom calls are just not the same. Either are window visits, either are when you have to have a mask on, or you can't hug somebody. All these things are just tragic right now. But we're doing what we can to keep happiness going on in the care center. So just, we're doing everything we can. The activities staff is wonderful, and the nursing staff understand how hard this is. So we're doing what we can. But from a technical standpoint, there has been just this past week some recent CMS, which is Medicare, and and some MDH updates to visitation. So because if you have one staff member or resident test positive in the last 14 days, you are in what's called an outbreak status. And when you're in outbreak status, there are no more visits are restricted because they want to make sure that it doesn't continue to spread. So they don't want to add fuel to the fire. So we have had our visits both outdoor and indoor suspended until we have 14 days with negative results. So we track that, I want to say every week, but really it seems like it's every day. So we're doing weekly testing for now, but we also, anytime there's symptomatic people, we test right away. So just know that that's a factor of whether we're in outbreak status or not. If you're in outbreak status, it affects how often you test and what your visitation guidelines are. But because we're in outbreak status, then you're not allowed to have these expanded indoor visits as we go forward. So we have to have this whole policy implemented by October 18th, 2020, but we're following the rules right now. And there'll be a lot more information to come. Right now, we're waiting on the Minnesota Department of Health to release its exact points so we can get that in our policy and make sure we're complying. I know all of you think, what does that mean for my mom and dad? Or what does that mean for my relative? It just means that we're going to have to utilize and do our best to remain positive by utilizing every Zoom call, every phone call, every window visit when possible that we can. As soon as we are out of that outbreak status, so we have 14 days of no positive tests, then we are going to move towards indoor visitation, and it's going to be a week-by-week basis that we have to make these calls. So if you want to go to the next slide. Okay. So I'm going to just kind of go this. Yeah, it's a week-by-week call. So let's look at our testing right now. So effective September 2nd, these mandatory CMS nursing home rules came effect. So if you have, we're going to be testing every symptomatic individual like we always have. You're in outbreak status if you have one or more long-term care staff or residents or assisted living tenants. We'll consider that an outbreak. We'll continue testing once a week, and all employees and residents and staff. And then the third one is if you don't have any, there'll be, I think, a further slide talking about the routine testing for staff. So, okay, we'll get to that in a minute. We'll finish out this other slide. So the next slide, we'll talk about routine testing for staff. So again, we look at the Minnesota county positivity rate. Actually, that's the CMS county positivity rate for our county every week. Based on that positivity rate, we'll be doing monthly, weekly, or bi-weekly testing. And that will be mainly primarily for our staff. So we're not going to subject the residents or the tenants to all of this testing. I think the most that we will do for the residents and tenants is weekly. So the resident and tenant will all have signed a consent to test. So we have that in place already. The positive cases in the care center and assisted living will continue to be communicated out to all of you. Okay. And if you have questions as we're going, put them in the chat box because I know this is a lot of info. So next slide, Kristen. Okay, so this is a kind of a cool slide that Kristen came up with today. And we hope that when we have this finalized, that this is what we'll do. It'll be like a snapshot of our testing. So in the care center, as you can see, she has it split between resident testing, and then down below is staff testing. And then in the assisted living section, she has tenant testing, and then down below is staff testing. So as you can tell, for the care center, again, we've had 0 residents test positive, 1 current staff member is positive, and 1 is fully recovered. Same thing in assisted living. We have 1 tenant positive, the assisted living staff, 1 current member is positive, being quarantined.
They've recovered. I'm sorry, I put that number in the wrong thing.
Okay. And then the assisted living staff has been recovered since. So as you can tell, everyone is tested until there's 0 positive results for 14 days straight. So we're doing what we can to keep testing because our whole intent is that we isolate any possible infectious person. And that's our reason. Our reason is not to limit visits. It's not to keep you from any of your loved ones. The reason is solely so we don't have a spread throughout our organization to the most vulnerable people that are here. So that's what we're working towards. And then the next section is really just dealing with how we test for staff. So Lac qui Parle's county positive rate right now is 4.1. If we have less than 5, we can test people once a month, unless you're in outbreak status. So even though we're less than 5%, because we've had a positive person in the last 14 days, we still are testing weekly, all of our staff weekly. But know that if you're not in outbreak status, but your county positivity rate is higher than 5%, doesn't matter if you had any positives, you're going to test once a week. If you're 5 to 10%, if you're over 10%, we're going to be testing our staff twice a week. So maybe too much information, and if so, I apologize. We're just trying to be as transparent as we can, so you guys know when staff are being tested, because you know they're out in the community. So when staff are being tested, and how we're trying to do our fiduciary duty to make sure that people are safe. So the last, we're getting towards the end here. Our communication has not really changed. Residents, we actually have a weekly or bi-weekly updates. So I usually go into the chapel area and go on the big screen. And we always do it right before or after bingo, because everybody's watching TV. And then we do an update, and we talk about the overall, if we have a positive case, we talk about testing, about remaining positive, and talk a little bit about the activities. So the other day, I think I must have done I must have got up and done a little bit of dancing or something. And one of the CNAs came over and said, this particular resident got up on his walker and was doing a little dancing with me. So they're tuning in to get the updates. So we also send a monthly Care Center family newsletter, and I believe Kristen's going to be including assisted living tenants with that as we go forward, just to kind of make sure everybody's getting the same updates. We'll be either emailing it or mailing it. We'd prefer to email it. So if any of you need to submit your email addresses, please send them in. Amanda, Kristen, they have their email addresses available. You can put them in the chat box. Just make sure that we get those email addresses. Okay, I see a question. Let me just finish. That we also post to the website. So we put these calls on the website, but Kristen also has posted a COVID update section split up for Care Center and assisted living. So if you have a particular one in either setting, you'd be able to see an overall summary of that. We send out a monthly e-newsletter called the Helpline that gives more of an overall update on what's going on in our organization. And of course, social media. So if you want to connect up with Johnson Memorial, we send a lot of fun pictures of the staff, of the residents, of the tenants when they're doing fun, joyful things, and just give some updates that way. So you have another slide, Kristen? Yep, so here's Amanda Redepenning, who's the Care Center DON. She also oversees the assisted living. Her phone number, also her email address. And if for some reason you don't connect with her, you can always reach out to me as well, and we'll add my name and number and email address on this before we post it today. Okay, so I see a question, and then we'll open it up for questions. So one question is from Nancy: what type of info updates go to assisted living residents? How do I know which family member gets the email? Okay, so the assisted living residents will also get all of the information to the manager who actually goes and talks to them. We've had talks about putting a TV in there that will also reflect the same connection, but it's a wiring issue right now, so we're trying to get through that. But there might be a way for us to put a TV kind of in the open area where people could go and watch these updates. So we're working on that to get them the COVID updates on a more timely basis. And then how do I know which family member gets the email? You can call into Amanda or email Amanda. We have one point of contact because it gets to be quite a problem when we have to contact 15 people for each resident or tenant. I know that some of you have submitted multiple email addresses to Kristen, but Kristen and Amanda are going to have to work through that because it gets to be, I mean, it doesn't seem like a lot to add an email address, but it's the ones that you don't add that cause extreme angst. So what we've done in the past is we've tried to make sure that at least one family contact has an email, and then it's their responsibility to email it out to whatever other family members feel they need that. Now, of course, if there's an extreme situation, you know, please don't hesitate to contact Amanda or myself and we'll work through that process. But definitely just email Amanda or me, and Kristen will add my name and contact to it. And we will verify which person is the contact, and then you can get in contact with that person. But again, we are trying to post almost everything that we email right out on the website. So we're just trying to be as transparent as possible, still protecting people's HIPAA privacy rules. You know, we're not going to say which resident, which tenant. We're not going to be doing any of that. If we have a symptomatic resident or tenant that warrants it, we're going to put them in our COVID isolation unit. But so far we have not had to utilize that because they've either been asymptomatic and been able to quarantine on the end of a hallway. We're just trying to do what's best to not only care for the person that has COVID, but all of the other people that want to protect them as well. So I'm going to stop talking for a couple minutes, and I'm happy to stay on for as long as possible. So if you guys have questions, just unmute yourself and share them with the whole group or put them in the chat box.
Stacy, this is Denise. What is your policy for the employees at JMHS about being out in public with their masks or not masks?
Great. Well, so no employer can mandate what their employees do once they leave the campus. That's very difficult to enforce. But we have rules within our 4 doors that every employee has to be screened and temped prior to coming in the building. They have to wear PPE at all times. So which means they have to be wearing their mask, which is not, they wear surgical masks and eye protection in the care center. They can't wear them like that. That doesn't count. Yes, they have to wear like Kristen is showing, and then there's eye protection goggles. So the one really good thing is that there have been asymptomatic staff members across all these organizations in Minnesota that have been identified with antigen tests where you can tell if you've had the virus. And there's been no outbreaks, at least in connection with that. So I think that's a good thing that the PPE really works. All we can do is strongly advise, and if we see or hear of a specific instance where a staff member is, say, at a bar, sitting up at a bar with people all crowded around, not wearing them, that is a personnel issue, but it's awfully hard for us to mandate what happens outside of our 4 doors. So we just do everything we can to mandate what goes on inside our 4 doors. I think somebody may be talking, but they are super, super soft.
Hi, this is Nancy Dino, and this is the first time I'm on the Zoom, and I want to thank you for everything that you're doing at the Care Center, for everyone there. Just a question, since I'm newer to this. Assisted living, they do have, you said in the statistics, 1 positive, so I'm not hearing of any activities going on because everything's got to be so kind of locked down. Will there be more activities so they can get out a little bit more, or do they have to stay in kind of in a more of a quarantine mode? Thank you.
Yeah, that's a great question, Nancy. And right now in outbreak status, it's making it difficult for us. We're working on different ways to try to connect up the assisted living building is a separate building that hasn't been wired in to the care center. So that's what's making it a little bit difficult. But I know that our activities staff, as well as even some of our administrative staff that are testing weekly, are going down there to have visits and to try to interact a little bit with the assisted living tenants. But the actual, I think they even did a craft over there, I want to say last week. But we can do a better job, even, Kristen, as if you think about it, maybe we need to, in addition to putting the care center activities, let's put the assisted living activities on a second slide or combine them. I think that might help bring some awareness about what might be going on there, knowing that it's never enough. But, and then we're also, like I said, working on that technology piece to be able so they can get updates on a more frequent basis. Now we have brought, when we're having some of these events that are going on, what we're trying to do is bring the assisted living, we're planning to bring the assisted living down at a different time than the care center residents. So right now in outbreak status, we have, the activities are very limited. But once we get out of the outbreak status, then we will open them back up. The pictures that you saw that Kristen posted, some of them were in outbreak status for the bingo piece, but some of them when we were not in outbreak status. And we were still able to have the outdoor visits. We were able to have the outdoor carnival. Now we're running into problems with that, with the outbreak. The last thing I will mention is once we're out of outbreak status for both assisted living and care center residents, we are converting a room that is right in that town center area. It used to be where we had the little kids for daycare. And we're working on putting plexiglass barriers so family members can come in and see the tenants and the residents when they can't do it in the room, in their own room, if they can come in there, because we know that over the holidays, it's going to be really tough and everybody's going to want to see people. And, you know, we can't have, you have to have 6 feet distance. So when you're in a room, you're how far apart and you can't have more than 1 or 2 people in there. So we're working on trying to do that for the tenants as well as the care center residents. But I'll be the first to admit that it's been tough with the assisted living because the tenants are usually much more social and they move around more and they're able to do things with each other and their friends and even help cook and bake in the kitchen. And it has been a real struggle because they're so much more mobile than the care center residents. It's been difficult. So, but I think it will help to get the list of activities out there. Sometimes the residents or the tenants might forget what's actually going on because they're bored or whatever. So we'll get the list of that out and we'll also post pictures like we do for the care center. Will that help, Nancy?
Stacy?
Oh, just a second, Robert. Will that help,
I'm sorry,
Nancy?
didn't mean to interrupt.
Yeah, I think that will help a little bit, not to talk about resident specific, but there's some limitations due to various site issues and things like that. So, and
Yeah,
when technology goes down, I'm not quite sure how to get some assistance. So I'll email Amanda directly on that. Thank you.
Or
And
me,
yeah.
if you don't get a response from Amanda, because she is working, also working the floor right now a little bit, but when you don't get a response from her, just make sure to email me as well and I'll look into that. Because yeah, I do know that there's some, and I think there's been some reading, some routine reading going on.
Yeah, and a lot of that's down, and a lot of when you talk about Zoom and things like that, if there's some technology assistance in a lockdown, I'm not quite sure how much more you can do. Thank you. And I live in the cities, so that's my own issue. So thank you. Thank you.
We'll work on it. Hey, Robert.
I'm wondering if you'll ever be able to get a Zoom meeting going for residents in the hospital setting, particularly those that have been there for a great deal of time.
We absolutely should if we aren't already.
Yeah, and my mother's been in the last 4 out of 5 weeks.
I know she has been. Yep.
Okay, that's
and
the
yeah,
reason
we should be able to set up. And if that request has been made and it's not been acted on, let me know. But I will go back and that should be possible. It's not hard to bring that in and set that up and have a Zoom call. We should be able to do that like we do any other Zoom meeting visits. Yes.
I was denied that access. So,
Yeah,
Please.
so was I.
You were denied it, Robert?
yes,
You were, and so was Denise? Okay.
Yep.
Yeah, and you know, we will look into that and then I will, we'll get back to both of you. But yeah, we should be able to coordinate that. We'll figure that out.
thank you.
Yeah.
Thank you.
Mhm. I think especially for our tenants and our care center residents, we need to have a process in place for that when they're in the hospital. Yeah, when they're able to too. I mean, there could be some, if they're really super sick, that might be difficult too, but when they're able to, we need to do that.
I've been standing outside our window, calling on the phone. You know, it ends up being maybe 4 or 5 minutes.
Yeah.
It's not a long time, you know, at least with the Zoom, the computer's there and you can still talk to her and she doesn't have to try and hold the phone. And
Yep, and we will definitely see how we can handle that and maybe that can, yeah, let us look into that and see how we can do that and be able to at least easily make a request to do that. So we have to figure out how we can handle that. So thank you. So I know we kept you guys a little bit later today, not much though. Thanks Dennis and Ruth. That's a private message. Yeah, we're working as hard as we can. It's a tough time right now, especially in our area where we're having higher rates of positivity and, you know, a healthy 25-year-old can handle this just fine. And so we just want to do what we can to still live lives, still have joyous moments, still connect with family members. Gosh, we just need that vaccine and we need one that works. And we're all COVID fatigued, but these residents and tenants towards the end of their life, it's tough. So. Heartbreaking, but heartwarming sometimes too. It's heartwarming to walk through and see. So we're doing what we can. And as soon as we get rid of this outbreak status, which we're really trying so hard, then CMS has changed that rule where they will, unless there's a reason not to, we're going to do indoor visits. So even if you have to schedule one and all of a sudden we move into outbreak, it's still worth the scheduling of it. So I'm sorry, Denise.
when will her quarantine be up, the residents' quarantine?
When our staff or residents, we have no positives in 14 days.
And you don't know when the ones that are on.
Oh, yeah. I mean, and it just also depends. So if you had, it's not really when the quarantine is up, it's this period of time of 14 days. So it's easy for, like, if we had a resident that tested positive, it might not be 14 days. They might be sick for 10 days and then they have to wait 14 more days. So that's why we're so lucky, at least the residents have not tested positive, because and then even the tenant that tested positive was not symptomatic. So, you know, it's just, there are flow charts and algorithms that are craziness to have to follow, but they're all for the best intention of keeping people safe. The piece that it's tough with is there are people that would probably be just like myself that would be like, at some point, I'll just get COVID. That's easier to say though than when it actually happens to you. So our obligation here is primarily the safety of the patients and the residents, and doing our darndest to try to make it bearable so we can get through this time, because we don't know how much time any of us have, but some of us are further down the line than others. And so we're trying everything we can do. So we'll keep on working towards improvement on that too.
Is that rate then dependent upon each division within the JMHS system, or does one positivity in the hospital and deny access all throughout the assisted care and care center.
No. So the positive cases are just in the care center and assisted living, and those that need to enter into those spots. But the positivity rate is a county positivity rate. So that's based on everybody. And that's the regulatory number that we need to follow when determining visitation and testing. And that's the rule today. We'll see what it is a week from today, but that's what it is today. So I won't keep you any longer, but you know, if you have questions, when we get this PowerPoint out, my email stuff will be on there. I think we'll put Kristen's on there as well. So you guys have a few people to contact. Please have as much grace with us as you can right now. We're, you know, if Amanda doesn't answer an email right away, just please forward it on to one of us, because we have some different shifts that people are working to try to cover things, and keep passing suggestions along. We'll do what we can. I mean, we take those to heart. So, I mean, I feel like I'm saying things what you want to hear, but I really mean it. I mean, we're trying to take suggestions and make things better. So the couple things I'm taking away from today is adding those extra contact names. We're going to go down and talk to the nurses at the hospital and work with activities on how to set up Zoom calls for hospitalized patients, especially the ones that are care center and assisted living residents and tenants. And then to try to pull together some of that assisted living activities into our Zoom meetings as well. Okay. Well, I'm gonna go because I guess I got some work to do. So thank you all, and we'll see you again in 2 weeks. And just watch the website for any other updates, and we'll hope for negative tests coming through again this week. So thank you all.